this episode of Banner Health's Making the Round podcast, we'll be highlighting a special 3-part series discussing screening, prevention, and treatment of melanoma. Making the Rounds dives into medical topics with those who know them best, healthcare providers. My name is Bridget, and I'll be your host for today's episode. And if you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. With me today is Dr. Jordan Abbott, dermatologist with a focus on oncodermatology at Banner MD Anderson Cancer Center. Thank you, Dr. Abbott, for joining me today, and welcome to Making the Rounds.
Thank you for having me. I'm really excited to be here today.
Well, we're excited to have you. Sun protection is a topic of focus for everyone, every day, every age. We're really excited to have you here, not only on this podcast, but here at Banner MD Anderson. Dr. Abbott, tell us a little bit about yourself.
I'm a dermatologist. I work here every day at Banner MD Anderson, so my focus is on seeing cancer patients. I see patients both with skin cancer and then with other types of cancer who are having side effects of their treatment that affects their hair, skin, and nails. As a dermatologist who sees patients with cancer every day, and particularly skin cancer, I'm really passionate about sun protection, so I'm really excited to be here today and talk about this.
Well, thank you. Other than exposure to the sun, what other factors can put you at an increased risk for skin cancer?
There are many things that can put you at increased risk for skin cancer. We do know that UV radiation from the sun is a known carcinogen that definitely puts you at risk, but there's also UV radiation that we're exposed to in tanning beds. And there are personal characteristics that can put people at risk as well, such as a personal history of skin cancer, a family history of skin cancer. There's actually certain medications that you can take that will put you at a higher risk for forming a skin cancer, and usually people's physicians have informed them about that, so people would know if they're on one of those medications. And then, unfortunately, there's also some medical conditions that put you at higher risk for skin cancer.
What types of medical conditions could put you at a higher risk?
Many immunodeficiencies can put you at risk for forming skin cancers because your immune system normally works to protect your skin from environmental insults. And so when your immune system isn't able to work as strongly or properly, you are at an increased risk for forming skin cancers.
So in regards to personal or familial history, what are some of those personal traits that can put a patient at an increased risk?
Yeah, so certainly having fair skin, having lots of freckles, light eyes, red hair, all of those are known and recognized factors that put someone at an increased risk of forming a skin cancer. Also, patients who have many what we call dysplastic nevi. So that's going to be these atypical moles. Those are usually something that a clinician would diagnose and then be able to tell that patient that they are at increased risk and recommend an appropriate screening frequency for them. In addition to that, sun exposure, someone's personal history of sun exposure, if they've had really frequent sun exposure or some intense sun exposure over their life. So a question that will often get asked of patients is, how many really severe sunburns have you had, or how many blistering sunburns have you had? And it might be someone who hasn't spent that much cumulative time in the sun, but if they've had 20 really severe sunburns, we know that they're at a much higher risk for forming skin cancers. In addition, a family history of melanoma in a first-degree relative is a known risk factor for skin cancer, or specifically melanoma. And tanning bed use is also a risk factor for all types of skin cancers, squamous cell, basal cell, and melanoma.
So as we mentioned exposure to the sun, are UVA and UVB rays the same?
So the sun emits UVA, UVB, and UVC rays. The UVC rays are filtered out by the ozone, so we don't really worry about those. For the UVA and UVB rays, those are different. Kind of an easy way to remember is that the UVA rays cause aging. So these ones penetrate your skin deeper and break down some of the collagen that leads to premature aging, wrinkling, some of those sunspots that you think of. And then UVB rays are the ones that cause a sunburn. And so these are different. Tanning beds are thought to emit mostly UVA rays, but we know that both UVA rays and UVB rays have been linked to skin cancers.
If I'm wearing sunscreen, can I stay in the sun in these UVA, UVB rays as long as I want?
Not necessarily. There's no amount of time that we consider it safe to be in the sun, especially if your skin is not protected. So anytime you are going to be spending time in the sun or your skin is going to be exposed to the sun, I recommend protecting your skin. When I think about protection, there's multiple modalities that someone can use to protect themselves. So traditionally, we think about sunscreen, but there are also UV protective clothing. Another thing that dermatologists often recommend is seeking shade. So if you're going to be out exposed directly to the sun, try to identify some things that you know around in your surroundings that you can use as tools to protect your skin. So whether that's being under an umbrella or in the car, if that's pulling down the little flap so that your face isn't exposed to the direct sunlight, there's often ways that you can protect yourself with barriers in addition to sunscreen.
As you mentioned sunscreen, can you share with us if there is a difference and if there are benefits of using a physical sunscreen versus chemical sunscreen?
Yeah, so when people are talking about chemical and physical sunscreens, they're talking about the filter that is in the sunscreen acting as the active ingredient. So chemical sunscreens use a filter that absorb UV light almost like a sponge, whereas physical sunscreens use a filter that deflect the sunlight. So your physical sunscreens are going to be the ones that contain minerals. These are titanium dioxide or zinc oxide. Traditionally, those are the sunscreens that people would describe as chalky or, forming a white cast. And in the past, I think those were the ones that people didn't love to use because they weren't really nice and easy to apply product. We've really come a long way in sunscreen formulations, and there are so many great physical sunscreens out there now that aren't these chalky ones that people think of historically. So yes, there's a difference between them in the way that they're working. There's also a difference in that if someone has really sensitive skin, they're probably more likely to have a sensitivity to a chemical sunscreen rather than a physical sunscreen. So when patients just describe that their skin is really sensitive, I often recommend a physical sunscreen. People also tend to prefer physical sunscreens if they're concerned about the systemic absorption of sunscreen. There's been recently some articles and some studies that are looking at the absorption of sunscreen in our blood level, and that's mostly focusing on these chemical sunscreens and those chemical filters. Physical sunscreens are thought to mostly stay on top of your skin and really deflect the sunlight.
What is the preferred level of SPF to protect from overexposure of the sun?
SPF 30 and higher is generally recommended. An SPF of 30 is going to block about 97% of the sun's UV rays. Higher SPFs do block slightly more, but there's no sunscreen that's going to be able to block 100% of the sun's UV rays. And even if you do use a higher SPF, that does not change the frequency at which you should reapply. So any sunscreen should be reapplied about every 2 hours, and using a higher SPF does not offer you a longer duration of protection.
Dr. Abbott, can you walk us through what a skin cancer screening looks like and what are you looking for?
Yes, so I see many patients every day for skin cancer screenings in my clinic. So this is an appointment with your doctor, dermatologist, to check your skin for abnormalities that are suspicious for skin cancer. So during this appointment, your doctor will likely have you undress and put on a gown. Usually you do keep your undergarments on, and then your doctor will check your skin from head to toe. When I'm performing these full body skin exams, I use a tool called a dermatoscope to assist me during the examination. A lot of people see this little tool in my hand and think it's a fancy magnifying glass, but it's actually a really interesting piece of technology that allows a physician or dermatologist to observe features below the skin surface. And that is helpful when you're looking at lesions that might be suspicious for a skin cancer. It's a diagnostic tool that we're able to use right at the bedside. So when I'm looking at a person's skin, I start with their scalp and work all the way down to their feet, looking between the toes and, covering all the areas of their body. Often along the way, I'm discussing with my patients what I'm seeing. We talk about the moles that are looking healthy and normal. We also identify other skin growths that they may have on their skin. And then I always make a point to address any spots that they have questions about. And we wrap up the visit by determining the frequency at which they should have this type of screening done. And if there's any spots that we're going to keep a close eye on, we make a plan for what that follow-up is going to look like, or if there's any areas on their skin that we need to test that day, we will discuss that and then proceed.
If you find something suspicious, what is that next pathway in treatment?
It really depends. So if I find something suspicious on my exam, I'm going to discuss that with the patient. And then depending on where it is on the body, the history of that spot is really important. Is this brand new? Has that been there for years? The patient's anxiety levels also something really important to take into consideration. If a patient's really reluctant to have a biopsy, that's completely understandable. I'll talk to them about taking a photograph of that site. We'll measure that site and we'll make a plan. I often have them come back at a relatively short interval, say a month later, and we both agreed, on that initial appointment, if the spot has changed compared with our photograph or measurement, then we will probably need to proceed with a biopsy because a spot that is evolving can be an indicator of something that is malignant.
So when you're talking about taking photos, monitoring, looking at the area of concern, can you share with us the ABCs of examining a patient's mole, spot, whatever that area of concern is?
Yeah, so the ABC mnemonic was developed to help patients and primary care physicians assess for changes in a mole or identify moles that may be suspicious for a melanoma. So it's really a tool that is used when we're talking about pigmented lesions. In my world of evaluating people for skin cancer, I'm also thinking about squamous cell carcinomas and basal cell carcinomas, which this set of tools does not really apply to. Those are going to appear differently, often as more of a pink spot or a sore that doesn't heal. But when we're thinking about moles, many people in the population have a lot of moles, and most of those are completely normal and healthy. Moles that may be abnormal can be identified by having asymmetry. So that means that half of the spot looks different from the other half of the lesion. So if you were to fold it in half, it doesn't really match up on both sides. B is for border. So the mole has an irregular border, meaning that the edge is not smooth. It doesn't have a nice, round, clean edge. It might just fade off into the periphery. C is for color. So that is going to be a lesion that has multiple colors within the same spot. So it might have a light brown component next to a dark brown component, or might have a pink area and a brown area. D is for diameter. So the cutoff that we think of is about 6 millimeters. Lesions with a diameter greater than that could be suspicious if they have another one of these characteristics. And then E is for evolving. If the mole is changing, it is normal to have moles change and grow under the age of 30, but after 30, we tend to think of mole that's changing as one that might be doing something abnormal.
Thank you, Dr. Abbott. When you talk about skin protection and sunscreen, there are a lot of myths, wives' tales, theories, and conversations surrounding appropriate sun protection and screening. We'd love for you to debunk some of those common misconceptions.
Okay.
Question number 1, myth or fact? Is it true that sunscreen deprives you of vitamin D?
Sunscreen use should not cause vitamin D deficiency for most healthy adults. Most individuals can obtain necessary amounts of vitamin D from their diet, and there's not a safe level of UV exposure from the sun or indoor tanning devices that would allow for maximum vitamin D synthesis without increasing skin cancer risk. So I really recommend that people focus on obtaining vitamin D from other sources and not relying on getting it from the sun. But for most individuals, using sun protection should not cause vitamin D deficiency.
Question 2, myth or fact? Is sunscreen the only way to protect your skin?
I love this question. Sunscreen is not the only way to protect your skin. It certainly is a really important and really common way that people protect their skin, but there's lots of other options. One way is clothing. So there is lots of clothing that has UV protective factor as a part of it, and that is a really nice way to protect your skin. Oftentimes when I have patients who tell me they just have a lot of trouble reapplying, or they have hobbies outdoors where they're in the sun for hours and they can never remember to reapply, I've found that those people really enjoy wearing UV protective clothing because the truth is you don't have to worry about reapplying on the areas that your skin is protected. So I always recommend that my patients wear a wide brim hat, sunglasses, and then have their skin covered either by UV protective clothing or sunscreen.
Question number 3, myth or fact? Does a base tan help protect against a sunburn?
Yeah, this is definitely one of those myths that has been widely distributed. A base tan does not help protect against a sunburn. There is no safe level of tanning of the skin. So anytime that someone is forming a tan, that is a result of DNA damage that has happened in their skin cells. So what a tan is really a way that your skin recognizes that it has undergone an injury and then is trying to protect itself. So it's producing more pigment to kind of go up on top of the skin cells, almost like an umbrella, and protect the skin cells underneath. Tanning is a sign that your skin has undergone some damage and it's trying to protect itself further. And we know that over time, that accumulated DNA damage is what does put someone at risk for forming a skin cancer.
Thank you, Dr. Abbott. Okay, last question, myth or fact?
Is it true that if you have darker skin tone, it doesn't require sunscreen or regular skin cancer screenings?
So darker skin does offer a slight natural UV protection, but it's nowhere near the level of wearing sunscreen. Sunscreen is something that is recommended for all people with all skin tones, and people with dark skin also do need to have skin cancer screenings.
Dr. Abbott, how important is it to do skin cancer screenings, and how often should a patient be screened?
Right now, there are not currently guidelines that address the appropriate skin cancer screening frequency for the general public. Certainly for individuals with a personal history of skin cancer or those with a really strong family history, they should be having their skin examined regularly by a dermatologist at least once a year. For those who don't have that personal history, it is recommended to perform self-skin exams at home. And so that's where those ABCDE rules come into play to help patients in that process. Certainly, if you are concerned about a spot on your skin, make an appointment to see a dermatologist. The dermatologist can look at your skin all over and determine what screening frequency would be appropriate for you. Another thing that's important about having a skin cancer screening is that a dermatologist will look at areas that you may not necessarily notice on your body. For example, the bottom of someone's feet or between their toes is an area that most people are not examining themselves. So unfortunately, sometimes when I've diagnosed skin cancers in this area, it's a spot that the patient has never seen and it has already progressed quite a ways. So that's an area that I recommend people are examining at home. Also, areas under the undergarments. This is an area that sometimes people aren't inspecting very closely, but I always ask my patients if there's anything that I need to see under that area or if they're comfortable with me examining those areas, because even though you are not getting a lot of sun exposure there, you can still develop skin cancers anywhere where you have skin.
Dr. Abbott, when we look at skin cancer prevention and we discuss screenings, can you share with us what is that daily prevention? What is it that a primary care physician should be sharing with their patient at every wellness checkup, whether it's the pediatrician sharing this with the parents of the child, if it's the primary care physician sharing this at the annual exam? What are those recommendations that you want to share with our listeners?
I generally recommend that people wear sunscreen every day. A lot of my patients, when I share that with them, they're very surprised to hear that. And so that does seem to be a recommendation that people generally haven't heard. And I'm sometimes surprised by that. One of the ways that I talk to my patients about this is I recommend that they just get in the routine of applying sunscreen to their skin in the morning, just like they would brush their teeth or wash their face. So I recommend that sunscreen is applied to areas of the skin that aren't going to be covered by clothing going out and about. So that includes their face. The ears are extremely important and often an area that gets missed. Same with the neck and upper chest. I also recommend that people apply sunscreen to the back of their hands. And if they are going to be spending time outdoors and they don't have on long sleeves, they should also be putting some on their arms. People think that, if they're going to be just going to work, they might not be getting any sun exposure. But just when you add up the cumulative sun exposure that someone gets day in and day out of walking in and outside, we know that UV rays pass through windows, so there's also exposure there. It's definitely important that people protect their skin, not just when they're spending time in direct sunlight.
Thank you, Dr. Abbott. As a dermatologist with a focus on oncodermatology, can you share with us a little bit about your relationship with the melanoma specialist at Banner MD Anderson and how you guys complement each other? As you had mentioned earlier in the conversation, that you do see patients that have undergone specific treatment and now have sensitivities. And how does that relationship work? And can you share with us a little bit about those shared patients patients?
Yes. So our melanoma team here, we have a lot of mutual patients, which makes the experience really gratifying because we're all on the same team to provide excellent care to these patients. What that might look like is, say we have a patient with a new diagnosis of melanoma and they come in and have surgery for their melanoma, and then they see the oncologist to talk about systemic treatment options such as immunotherapy for their newly diagnosed melanoma. And then if they're on immunotherapy for a few months, they might be coming over to my clinic because now they have a rash that has popped up while they're on immunotherapy. And so one of my goals is to help patients through their cancer treatment process without having to stop or hold their therapies. So a lot of times these cutaneous side effects or side effects in their skin are a reason that patients want to stop their treatments temporarily or put them on hold. We try to work together to develop a plan for the patient, decrease their symptoms and make them more tolerable so that they can continue on their treatment. I also will see many of these patients for their just regular skin checks because we know once you've had a melanoma or another type of skin cancer, you are at higher risk for forming another, especially in the short term. If this patient is not already plugged in with a dermatologist in the community, I will see them for their regular full body skin exams. And it's a really neat collaborative team that we have here because the patient will continue to follow with me after they've been treated for their cancer just for preventative screenings. But say something comes up right next to their surgical site, I'm working across the hallway from Dr. Gimbel and am able to often pull him into a room to see this patient, or Dr. Mahmood and I will both see the patient together if they're having a reaction to their immunotherapy. So there is a lot of teamwork that goes on.
Thank you so much for taking the time to speak with us today and educating us on the strategies for sunscreen and sun protection.
Thank you for having me.
To learn more about the dermatology services and melanoma specialist at Banner MD Anderson Cancer Center, please visit bannerhealth.com/cancer for more information. Thank you for listening, and we'll see you next time on Making the Rounds.